The next discussion is the salivary glands. The salivary glands are the exocrine glands that secrete the saliva, divided into the major containing the parotid, submandibular, and the sublingual glands. And the minor glands are the hundreds of microscopic glands distributed throughout the oral mucosa. Mumps is the first topic in this section. Infection with the mumps virus resulting in the bilateral inflamed parotid glands. So this is high yield. The mumps resulting in the bilateral inflamed parotid glands. Orchitis, which is the inflammation of the testicles, pancreatitis, and the aseptic meningitis may also be present as a complication of the mumps infection. Serum amylase is increased due to the salivary gland or pancreatic involvement, and the orchitis, which is the inflammation of the testicles, carries risk of sterility, especially in the teenagers. The next one is the silidinitis, inflammation of the salivary glands, most commonly due to an obstructing stone, say sialolithiasis, leading to the Staphylococcus aureus infection, usually unilateral. Pleomorphic adenoma is the most common benign tumor of the salivary gland, which is the benign tumor composed of the stromal, the cartilage, and the epithelial tissue. Most common tumor of the salivary gland usually arises in the parotid, presents as a mobile, painless, circumscribed mass at the angle of the jaw. High rate of recurrence, extension of the small islands of the tumor to the tumor capsule often leads to the incomplete resection in this case. Rarely may transform into the carcinoma, which present with the signs of the facial nerve damage. Facial nerve runs through the parotid gland. So this is super high yield. If there is the involvement of the facial nerve or the signs and symptoms of the facial nerve paralysis or the problem of the facial nerve, so you should think about the metastasis or the malignancy in this case. So next one in the session in the section is the Wharton tumor, benign cystic tumor with abundant lymphocyte and the germinal centers, which include the lymph nodes like the stroma. Second most common tumor of the salivary gland. So the first one was the first most common benign tumor was the pleomorphic adenoma, and the second is the Wharton tumor. Almost always arises in the parotid. The next one is the mucoepidermoid carcinoma, which is the most common tumor, malignant tumor of the salivary glands, composed of the mucinous and the squamous cells. Most common malignant tumor of the salivary gland usually arises in the parotid, commonly involves the facial nerve.